Well, let's start the latest news updates we have in the studio. Some angry youth at Ekumfie Isem in the central region nearly lynched the Deputy Minister for Fisheries and Aquaculture over the weekend. Francis Ato Kujo, who is a member of parliament for the area, had gone to the town to attend the Akwambo festival on the invitation of the chiefs. And according to the youth, the then candidate Francis Ato Kujo promised to provide jobs and also make sure that Ekumfie Isem gets its own senior high school if he was voted into office. Well, speaking to JoyNews, Kofieje, some of the irate youth said the MP hasn't fulfilled any of these promises since he was voted into office. When he was allowed to speak, the MP asked the youth to be patient, saying that what the MPP government has been able to achieve so far was commendable.
As I 1 year, NDC by 1 year in there. Yeah, one day say one factory. Make us say a Kumfi factory can one. Your 136 factory. What would I was where to be that 1 year?
When we came into power, we started the One District, One Factory project, and Ekumfie is benefiting from this, as you all know. We also introduced school feeding, free SHS, teachers training allowance, and nurses training allowance. All of this, the NDC didn't do.
Teachers training allowance, MPP Daba, NDC 1 year. Nursing training allowance, Yadaba, what do I be? Then you may not up Kashima, or you have by the mother horrible.
Meanwhile, the Mrahin of Abiade Nanaiko Grant has described the action as unfortunate.
It's not right. We invited the MP. They shouldn't have attacked him. They should have waited and later approached him if they had any issues.
Well, let's move on. And we'll disband our vigilante groups if the New Patriotic Party does same. And that's a response coming from the General Secretary of the National Democratic Congress to the National Commission for Civic Education. The NCC last week described as unfortunate Mr. Esiedun Ketia's defense on why the NDC had set up its own vigilante groups, saying such a development should be discouraged. But in a sharp rebuttal, Mr. Esiedun Ketia says the new groups, the Hawks and Dragons, will be dissolved only if the governing New Patriotic Party dissolves its own invisible forces and other vigilante groups affiliated with the party.
The National Democratic Congress NDC at its regional elections held last week outdoored 2 vigilante groups, the Hawks and the Dragons. This was condemned by many Kenyans. But General Secretary of the party, Johnson Esiedun Ketia, defended the party's decision to form such groups, saying it was in response to President Akufo-Addo's bad management of vigilante groups affiliated with the NPP.
I endorse it fully as a proper response for the incalcitrance of the ruling government and their refusal to do anything about the vigilantes on the NPP side. You realize that for 2 years now, we have all been complaining about the rising incidence of vigilantism in this country. The president promises that something will be done and nothing gets done. Some of us have been affected by vigilante attack and yet nobody had been held responsible. We will endorse any emerging vigilante group within NDC if that is the way to make sure that we are all protected.
The National Commission for Civic Education, NCCE, hit back at the NDC for its, quote, endorsement of the act, describing it as sad. The NCCE further asked that such acts be discouraged at all costs. But Mr. Esiedun Ketia, in response to the criticism by the NCCE, explains the NDC will disband those groups if the NPP does same. Here are extracts of that statement.
The General Secretary of the NDC, Esiedun Ketia, indicated the party's readiness to ensure such groups are disbanded, but that will happen only if President Akufo-Addo shows signs of readiness to protect lives and property. He wants members of the numerous vigilante groups aligned to the NPP arrested and prosecuted. He buttresses his case with the forcible release of MPP suspects from police custody in Kumasi, the forceful ejection of some chief executive officers of state-owned organizations from their offices. He says the NCCE is late in condemning acts of party vigilantism, indicating that he is surprised at the new awakening of organizations like the NCCE.
Well, the back and forth will go on till maybe one party decides to give in.
Zongo and Inner City Development Minister Dr. Mustafa Hamid has defended construction of sports facilities in Zongo communities across Ghana. He says the ministry is prioritizing the education of children, but also knowing that the centers and their importance to recreation and development of young people cannot be overemphasized. Dr. Hamid spoke to JoyNews on the sidelines of a sword cutting for a construction of a second sports complex at Aboabo Aquarium in Asokore-Mampo municipality. Ohim has more on the story.
Highlanders Sports Complex, to be developed at a cost of 3.4 million Ghana cedis, will have artificial football and volleyball pitches, among other facilities. Similar facilities have been constructed at Otafu in Kumasi, as well as Fadama and Medina in Accra. The Aboabo Aquarium Complex, to be completed in 5 months, will also serve as a community center for the Aboabo and Aquarium communities. Dr. Hamid tells JoyNews the ministry is working on various programs simultaneously to improve the well-being of Zongos.
Our priority is education as a tool for developing Zongo communities. But in educating our children too, we need recreational grounds for them. All work and no play makes Jack a dull boy. So as we are developing our educational facilities in our Zongo community, we are equipping schools, we are providing schools with furniture, we are rebuilding schools and so on. But after school, what happens? We need a recreational ground like this so that the children can come. Because after school, most of the time they go onto the street, the parents don't know where they are. But if the community has a recreational grounds like this, where they can come and play, whether it is table tennis, basketball, it's part of exercising.
Municipal Chief Executive for Asokore-Mampo, Ali Duseidu, tells JoyNews the Assembly will regulate the use of the complex to ensure it serves its purpose.
You remember in 2015, there was 9 people died at Aswanse Community Center. One of the reasons has to do with the fanfares and jams after Salah. We have no control, but whilst this AstroTurf is in place, there will be the reason to also use it in that regard.
From Kumasi, for JoyNews, I'm reporting.
Well, let's move on. The Ministry of Health says it has secured financial clearance to absorb unemployed bonded nurses. Health Minister Kweku Agyeman assures the district nurses will receive their appointment by the end of 2018. It was addressing the Nurses and Midwifery Council mid-year review meeting at Nsuta in the Ashanti region. It's from where Nana Asenso Mensah reports.
Over 1,000 bonded nurses nationwide last week took to the streets to register their displeasure over staying home for more than 2 years without placement. But this could soon be over, because the aggrieved unemployed nurses will soon receive the appointment letters and placement to start work in 3 months' time. But Sector Minister Kweku Agyeman has been explaining what contributed to the delay.
As far back as March, we asked even those who attended private schools to come to register so that we can capture their data to know how many were still sitting at home. Some have sat at home for as far back as 2012, and we sympathize with their cause, right? So this year what we tried to do was to bring all of them on board. And we applied for financial clearance from Minister of Finance. So we have to hesitate a little bit to get our numbers right. That is what delayed the issuance of the financial clearance. And we have always been in touch, talking to them to exercise restraint and all that.
Meanwhile, Mr. Agyeman said the clearance from Finance Ministry is ready to absorb all unemployed nurses in 3 months' time.
Luckily, after pressure, we have got the financial clearance issued, and we start looking at how quickly we can put them on payroll. That can be accommodated for this year. So I think that by close of the year, we might have given the appointment letters, we might have posted them. What we don't want to do is to post them and they will go and stay there for 2 months without salary, and then we create salary adjust. We don't want to do that. Last year, all those that we posted, dead on, we pay them their salaries, and we want to do that the same year. So now that we've got a financial clearance, next few weeks we'll start doing their interviews and putting them into places for them to get some jobs.
Reporting for JoyNews, Nana Asensumensa.
We still have to stay on health, and the Deputy Director of Clinical Services at the Northern Regional Health Directorate, Dr. Brahima Abubakar, has called for the establishment of a psychiatric home in the Northern region to take care of the 3 regions in the north. Currently, Ghana has only 3 psychiatric homes, all based in the southern part of the country, something he said is hindering mental health care and its delivery in the area. He said the 3 northern regions have no psychiatric hospital as well as no psychiatrists, which compounds the situation. Matilda Bugre has more.
Dr. Brahima raised these concerns at the relaunch of the Maternal Mental Health Project in Tamale. The project is to cater for the needs of mentally ill women, their children, and their caregivers. He said there was a need to engage an expert to handle the issues of mental health.
We do our best at the preventive level and community level. And so if in any situation where somebody's condition will need to be institutionalized and be given a long-term care, there's no facilities. So the biggest challenge we also face is the absence of a psychiatrist.
The executive director of Bukatimali Society, Sheikh Yakubu Abdul Karim, said screening exercise will be taken for women and girls within the 3 years of the project. He said nurses would be at the center of the screening.
Now we are targeting pregnant women and women in general who are actually mentally ill or epilepsy, including their children. And for this particular area, the method that we're going to use is to screen by professionals. So we have brought these people together, the professionals together today in the region to share with them what their role would be.
Coordinator of Basic Needs, Adam Dokurugu Yakubu, said the 3-year project funded by the DFID UK Aid and the European Union would train and support 400 midwives, 800 community health nurses, and 900 community health volunteers.
Well, so that's it for the latest news updates we have. Please get interactive throughout the rest of the show. We have to do review of the newspapers, and it's up next. Stay on.